Hello and thanks for logging on. I'm Dr. Peter Glidden, and this tutorial is about tinnitus or ringing in the ear. Hope you enjoy it. So in order to understand tinnitus or ringing in the ears, it helps to have a little bit of an understanding of anatomy, real basic stuff. Don't worry, there's going to be no test here. Here's a picture of the human skull, and of course the main function of the skull is to protect the brain being certainly the largest, well, the second largest organ in the body, and the main part of the central. And the brain and the spinal cord are intimately connected. And here's an MRI actually of somebody's head. And you can see there's the skull bone, there's the brain itself, there's the spinal cord, goes all the way from the brain all the way down to your back into your butt. And of course the spinal cord is protected by the backbones, the vertebrae, and these of course are the things that the chiropractor adjusts. Now if we were to look at the brain from the bottom, this is a picture of the brain looking at the bottom of the brain. The front of the brain is up top and the back of the brain is at the bottom. We're looking at it from the bottom up. The white fibers that you see here are called 12 cranial nerves, and there's 12 pair, 12 on each side of the brain. Now, the cranial nerves go to the eyes, ears, nose, mouth, and throat, and the face. Every other nerve in the body exits from the spinal cord and goes to everywhere else in the body, like the heart, the livers, the kidneys, the lungs, the skin, the muscles, right? Most of the nerves that innervate most of the body come out of the spinal cord itself, but there are 12 nerves that come directly off of the brain. And those nerves go to your eyes, ears, nose, face, mouth, and throat. But to get to the eyes, ears, nose, mouth, face, and throat, they have to go through the skull. And in get through the skull, they go through holes in the skull. And now if you were to take the top of this skull off and look at it, this is what we would see. This is looking at the skull from the front, looking towards the back. This is the base of the skull. And you can see that it's filled with holes, right? There's 12 holes on each side. And guess what? Whenever the fella said, I need that like I need a hole in my head, well, you already have lots of holes in your head, and they're given numbers. The holes in the head are given numbers which correspond to the cranial nerves which go through them. And here's a list of the cranial nerves, right? The olfactory, optic, ocular, motor, etc., etc. These different nerves go through different holes in the skull in order to get where they're going. And this is important. We're going to come back to why this is important. Let's take a closer look. Here's the eye socket, and you'll see inside the eye socket there's a big hole and then there's a little hole. We're going to take a look at the little hole. This is where the nerve that feeds your eye, the optic nerve, comes through. We're going to take a closer look at that here. You can see this is blown up, and this is the actual, an artist's rendition of the optic nerve and blood vessels, arteries and veins that are coming through that hole in the skull in order to get to the eyeball. It's fascinating. Now this same process happens in all the other holes in the skull, and here's another example, right? There's a nerve and blood vessels coming out of that hole, and that particular nerve feeds the muscles of the face. So depending on the hole, position of the hole depends on which nerve goes through it, and that nerve is traveling, of course, to the eyes, ears, nose, mouth, or face. In order to get work done. Get her done. Now, when we're talking about tinnitus or ringing in the ears, it's the acoustic nerve which is involved, and it's the 8th cranial nerve. Here's a little cross-section of the ear and the outer ear and the inner ear, and let's take a walk through ear anatomy. There's, of course, the outer ear, and there's the ear canal, and there is the eardrum, and this is the thing that MDs in their backwards, old-fashioned, archaic treatments punch holes in when little babies and infants and toddlers get ear infections. They put little tubes in the eardrum, which is a very painful procedure for a kid to go through, instead of getting on board with a therapy which drains, which opens the eustachian tube, which is right here. This is a tube that goes from the middle ear into the back of your throat, and it drains the fluid that naturally accumulates in the middle ear. When kids get ear infections, it's because this eustachian tube gets clogged. It's clogged with mucus, or it's just inflamed and it's closed. It's a relatively easy thing to fix with holistic medicine, and that's a whole nother lecture, right? Now, let's take a look at another part of the ear, or other parts of the ear. This is a cross section, and this is the skull. This, of course, is the skull bone, and it is the skull bone that the 8th cranial nerve has to go through. It has to go through, there it is, the 8th cranial nerve, and the hole that it goes through is called the internal auditory meatus, which is just fancy schmancy doctor talk for the hole in the skull that the auditory nerve goes through. They got to name everything, so that's what they called it. Now, this part of the ear regulates your balance, and you can see that there's a little branch of the 8th cranial nerve that goes there. It's called the semicircular canal, and it is this part of the ear that regulates your hearing. There are 3 bones here that are attached to the other side of the eardrum. They're called the incus, the malleus, and the stapes. You experience a sound vibration. The sound comes in through the ear canal. It hits the eardrum. It makes those bones resonate, and those bones send their signal along the 8th cranial nerve to your brain. This is all going to make sense in just a second. Just want to give you a little background of this anatomy. Because depending on which branch of the 8th cranial nerve is affected is going to lead to 1 or 2 different conditions. And that's a secret. I'm going to tell you what that is in just. Now, the tunnels that exist in the skull, the holes in the skull that all of the cranial nerves go through, when the body is healthy, the tunnel wall has structural integrity. And when the tunnel wall has structural integrity, it maintains itself, and it's just an open, clear, beautiful tunnel. However, when your body runs out of the raw materials, to keep the tunnel walls strong, your body freaks out and starts to put braces inside the tunnel in order to keep it from collapsing, because guess what? If it collapses, you go deaf, dumb, or blind. Right? It's pretty important that doesn't happen. Your body has wisdom that's built into the body. Your MD is completely unaware of this, doesn't believe that the body has wisdom, does not believe that the body can fix itself, but it can, and it does all of the time. So when you run out of the structural stuff, the components, the raw materials that the tunnels in your skull need to maintain their structural integrity, your body starts bracing the tunnel with cross members, just like they did in World War II, tunneling out of the Stalags, right? They had to brace the walls of the tunnel. Well, the same thing happens. To keep the walls of the tunnel strong, the body needs minerals, especially calcium. It needs sulfur-bearing molecules, and everybody's heard about these: glucosamine sulfate, chondroitin sulfate, and hyaluronic acid. And it also needs the mineral selenium. It needs a number of other nutrients as well, but these are the big players when it comes to maintaining the structural integrity of the tunnel. When your body runs out of these things, the structural integrity of the tunnel becomes compromised, and what does your body do? Well, there's a nerve, picture of a nerve going through the tunnel, and if the tunnel was healthy and strong, it would just be the nerve inside the tunnel and nothing else. But when the body becomes weak, when the walls of the tunnel become weak, the body puts connective tissue cross members inside the tunnel to shore it up. Invariably, some of this connective tissue will rub up against the nerve, causing irritation to the nerve. Remember, this connective tissue should not be there. It was an afterthought of the body. It was a rescue mechanism of the body. Why? Because the body ran out of the structural stuff that it needed to maintain its integrity. Oops! Now we've got connective tissue inside the tunnel. Well, that's better than the tunnel collapsing, but nonetheless, there's connective tissue in there now, and it rubs up against whatever nerve it's going to rub up against. You're going to get different symptoms, different neurological symptoms. So if it rubs up against the olfactory nerve, which regulates your sense of smell, you're going to have funny senses of smell, or you're going to lose your sense of smell. If it rubs up against one of the nerves that goes to your eye muscles, you're going to get a lazy eye. If it rubs up against a nerve that goes to your facial muscles, you're going to get facial paralysis, which is called Bell's palsy. If it goes to one of the nerves that gives sense signals to the muscles of your face, you're going to get a condition called tic douloureux, which is extremely painful, and so forth and so on. And of course, if the nerve that's affected, the cranial nerve, the acoustic nerve, you're going to get one of two things. If it's this part of the nerve that's affected, you're going to get ringing in the ears, and if it's this part of the nerve that's affected, you're going to get vertigo. Because remember, that semicircular canal regulates your balance, and the other nerve regulates hearing. Again, this is not rocket science. From the correct perspective, everything makes sense. Tinnitus is caused by a facultative breakdown in the structural integrity of the hole in your skull that the 8th cranial nerve travels through. It's basically osteoporosis of the skull, which, quite frankly, sounds a lot worse than it is. This is not genetic. It's not caused by aging. It's not a voodoo curse. The only thing that causes this is your body has run out of the stuff that it needs to keep the bones healthy. And you are probably, most likely, undoubtedly, unwittingly consuming food that's robbing minerals from your body. So, it's like kicking someone when they're down. If you eat all the wrong food all the time, and if you don't have a supplementation program in place that feeds your bones and your joints, guess what? Your bones and your joints are going to suffer. And when the bones and joints in your skull become compromised, you get all of these symptoms related to one of the 12 cranial nerves. In this case, it would be ringing in the ears. It's that simple. Now, all of this, of course, begs the question, well, how does one support and promote healthy bones and joints? Well, in this case, it would be just healthy bones. Boniva? Are we going to use Boniva? Are we going to use Fosamax? Are we going to listen to Sally Field? Use once monthly Boniva to build bone density to help keep my bones strong and healthy? Well, no. If you've noticed, Sally Field ain't around anymore pitching Boniva because it's the latest in a round of class action drug suits because Boniva and Fosamax are a type of drug, family of drugs called bisphosphonates. And here are just a few of the side effects of bisphosphonates. Severe musculoskeletal pain, funky heartbeat, atypical fractures, imagine that, you step off of the curve and you break your leg, cancer of the throat, and my favorite, osteonecrosis of the jaw, which means your face falls off, all because of Boniva. Now, I've been telling people for 6 years that Boniva is bad. And finally, those chickens come home to roost. This is why you don't see Sally Field pitching this nonsense anymore. And quite frankly, any doctor that prescribed this stuff, in my opinion, should have had their license yanked. Because even a first-year medical student could have told you that this was an absolutely insane therapy. Now, I have a whole nother tutorial about osteoporosis that explains exactly what Boniva and Fosamax do and why you shouldn't take them. Again, that's a subject for another webinar. But the take-home message here is we're not going to do prescription medicines for this, not because prescription medicines are bad or evil, but because for healthy bones and joints, they don't work. As a matter of fact, they're loaded with side effects, and if you try to support and promote the health of bones with pharmaceuticals, you can't do it. But you can do it the Dr. Wallach way. You can do it based on $25 million of federally funded research and over 3 decades of clinical experience by licensed naturopathic physicians. That would be a smarter way to attempt to help your bones of your skull, in this case, maintain their structural integrity. And how do we do it? Well, it's easy. We have something called a Healthy Bone and Joint Pack. Guess why we call it the Healthy Bone and Joint Pack? Because it supports and promotes the health of your bones and joints. So the recommendation is 1 Healthy Bone and Joint Pack per 100 pounds of body weight per month, plus 1 bottle of plant-derived minerals. No surprise there. 1 bottle per 100 pounds per month. And something called selenium, because remember in that little slide, your body needs minerals, and it needs selenium, and it needs sulfur-bearing molecules, the glucosamine. Well, the glucosamine and the calcium are in the Healthy Bone and Joint Pack. The minerals, of course, contain minerals, and there's the selenium, our old friend selenium, which rounds the whole thing out. The recommendation there is 2 bottles of selenium per 100 pounds of body weight per month. This is arguably the best way to support and promote the health of your bones. It's just fantastic. You wouldn't believe the things that I've seen people recover from with this combination of product. Now, we must not forget the matrix, however, when we're talking about supporting and promoting joint health, of bone health. No, I don't mean that matrix. I mean the bone matrix. The bone is not just calcium and minerals. The bone, any bone in the body, including the skull, is a skeleton, a cartilage skeleton, onto which minerals have been glued. So when we're supporting and promoting the health of a bone, in this case the skull, we need to pay attention to the skeleton of the skeleton. How about that? Rather than just the outer hard coating of the skeleton. And in this case, the skeleton of the skeleton, the matrix of the skeleton, is glucosamine sulfate, chondroitin sulfate, and hyaluronic acid. These are the sulfur-bearing molecules that make up the bony matrix that the hard minerals are attached to. And in order to get that job done, the recommendation is 1 glucogel. The product to get here is called glucogel. It's 1 glucogel capsule per 10 pounds of body weight per day, which means if you're 150 pounds, you need 15 per day. You have to calculate how many bottles a month you need. They sell this, the Youngevity company sells the glucogel in 120 capsule bottles or 240 capsule bottles. So you just figure out how many bottles you're going to need to make up the dosage per your body weight per month and order it. It's pretty straightforward. Now, if you don't want to take that many pills, and by the way, if you were taking 15 pills per day, in this case, you'd take 5 with breakfast, 5 with lunch, 5 with dinner. You spread them out. Some people don't like to take that many pills, so we have the glucogel, sulfur-bearing molecules, and liquid. And the recommendation for that is relatively straightforward. It's 1 ounce of the liquid per 50 pounds per day. So again, if you're 150 pounds, by example, you would need 3 ounces per day. There's 32 ounces in 1 bottle, so you'd need to figure out how many bottles a month you would need to purchase in order to meet this dosage goal. And there is the glucogel capsules, and there is the glucogel liquid. So this is important. We need not forget the sulfur-bearing molecule skeleton of the skeleton that the hard minerals are attached to. And this is part of our secret sauce. It's the glucosamine supplements here that really provide the extra punch that makes our therapeutic intervention to make bones and joints in the body healthy and strong much more effective than anybody else's. This is the secret sauce, the sulfur-bearing glucosamine glucogel supplements, so don't overlook those. Now, there are alternatives to the Healthy Bone and Joint Pack. If you have a lot of food allergies, then you might not like the Healthy Bone and Joint Pack. because one of the main supplements in the Healthy Bone and Joint Pack is called Beyond Tangy Tangerine, and there are 117 fruits and vegetables in that. Very concentrated, awesome supplement. However, if your gastrointestinal tract has been compromised and you suffer from food allergies, that supplement might not like your body. Your body might not like that supplement. All right? So if that's the case, then, well, guess what? We have a workaround. This actually is my favorite way to support and promote bone health. I'm thinking about calling this the Dr. Glidden Pack. It's one bottle of Ultra Body Toddy, which is a multiple vitamin, multiple mineral, multiple amino acid, antioxidant, a liquid supplement. The recommendation is one bottle per 100 pounds per month. Calcium Toddy, the name for this is Cal Toddy. It's another form of liquid calcium. It's my favorite because it has more magnesium than any of our other liquid calcium supplements, and I like it because of that. The recommendation there as well, one bottle of Cal Toddy per 100 pounds per month. We need the essential fatty acids to round out the 90 essential nutrients. You can get one bottle of EFA Plus per 100 pounds of body weight per month. Of course, there's our selenium. That dosage remains the same. 2 bottles of selenium per 100 pounds of body weight per month. And there's our old friend, the glucogel. And you already know how to dose that. 1 capsule per 10 pounds of body weight per day, or 1 ounce of the liquid per 50 pounds of body weight per day. See, we have a number of ways to skin the cat here to support and promote the... Now, there is a way to get symptomatic relief of ringing in the ears while you're waiting for the medical nutrition to take hold and to fix the problem. You wouldn't plant a tomato seed on Monday and expect to be eating a tomato on Friday. It just doesn't happen that quickly. Well, healing doesn't happen that quickly either, but it happens. If you have ringing in the ears and you start the medical nutrition program, it's probably going to be 4 weeks until you notice a remarkable change. It depends really on how bad it is and how much damage there's been done, how much connective tissue has been laid down in that tunnel, your body weight and your vital force, and there's all these variables. But generally speaking, you're not going to experience anything remarkable symptomatically within the first 4 weeks. There might be gradual change. But in order to generate symptomatic relief of the ringing in the ears while you're waiting for the medical nutrition to kick into gear, here's what I recommend. Go to CVS and get some earwax removal stuff called Debrox or Debrox. I think it's called Debrox. It's a little oil that you put into your ear and it dissolves the wax. And then there's a little bulb syringe that you fill with warm water and you squirt that into your ear and it flushes out the wax. It's a really good thing to do a couple of times a year. Once you've gotten the wax out, then you use the CM cream, liberally applied to a Q-tip, and insert it inside the ear canal on the side of the ear that you hear the ringing. And the CM cream is part of the Healthy Bone and Joint Pack. So if you go with that option, you're already going to have a bottle of the CM cream. And by the way, we use the CM cream topically to knock down pain. It's a natural anti-inflammatory without any of the bad side effects. So if you have joint pain, knee pain, shoulder pain, hip pain, while you're waiting for the medical nutrition to kick in internally, you can rub the CM cream on top of the joint externally and it will knock down the pain. You can also put it on a Q-tip and stick it inside the eardrum, which is, well, not the eardrum, the ear canal. Stick it as far up inside the ear canal as you can, and as much as you can. Really load it onto that Q-tip and stick it right up inside the ear canal. Be careful that you don't, puncture your eardrum. It's a very hard thing to do, but when you're sticking anything in the ear, you want to be careful, of course. But the idea is to get the cream as far inside the ear canal as you can, because it will absorb through the soft tissue and hopefully knock down the inflammation that's happening to the 8th cranial nerve, the acoustic nerve, in order to reduce the ringing in the ear temporarily while you're waiting for the medical nutrition to work. And by the way, if this therapy works, you feel it within 30 minutes and it lasts for 3 to 5 hours. So if it is an effective treatment for your type of tinnitus or ringing in the ears, when it wears off, you just apply more. Because it's non-addictive, it doesn't produce any negative side effects, and you can just keep using it and using it and using it until you don't need to use it anymore. And that, ladies and gentlemen, is the long and the short of the medical nutrition approach towards tinnitus and ringing in the ears. I hope you learned something. I'm Dr. Peter Glidden. I appreciate your time. I will see you in the next tutorial. Attached to the last slide here for a breakdown of my recommendations for how to